Hello, everyone. I'm Dario, and my partners are Alfredo and Adrian. In this case, we're going to talk about violet biotechnology. The violet biotechnology is not about working in a lab with bacteria or plants. Their main thing is the legal and ethical part of science. It focuses on rules that scientists must follow to protect people and their environment. The most important points are the biolaw. In this case, this is the part of creating laws or control how we use genetic information. Also, we need to talk about bioethics. Here, you need to discuss if a new technology is good or bad for the humanity. Also, we need to talk about intellectual property rules, about who owns patents for the new discoveries, and the privacy. We need to protect your personal genetic information, so nobody you will use it without your permission.
Or just in case is the large companies drop in the development of new antibiotics. On recent years, many companies abandoned the antibiotics area for changing into another ones. For example, AstraZeneca spun out its antibiotic assets into a smaller company in 2015, reducing enormously the staff. In 2017, the medicines company exited the field, selling their antibiotics programs to Melinta. But in November of 2018, Melinta eliminated most of its research and developmental efforts. In 2018, Allergan, Sanofi, and Novartis pulled out of the area, some leaving their investigations to small companies. But why are they doing that? The main reason is that the benefit in producing a new antibiotic is way lower than the cost. Than producing a new treatment that includes an antibiotic has not much difference in the cost of production, but the difference between both of them is the benefit later when commercialized. Plus of that, antibiotics consume a lot of time, so from an economic perspective, it is better for companies moving to other areas that can give a higher profit. But what is the problem? The main problem is that the number of effective antibiotics is steadily declining, while the number of resistant bacteria is steadily increasing. Approximately less of 15 antibiotics have been approved since the 2000s. This is leading to a major global health crisis. Currently, 2 million people are getting infected by drug resistant bacteria, and 1 million are dying annually. In 2017, a woman was treated with all of the 26 antibiotics available in the US to fight a bacteria, and she died because of the infection. But more terrible are the 10 million of deaths annually projected for 2050 if nothing is done. Furthermore, if the companies shut down their research and development departments, the small companies that are focused on the development of new antibiotics can lose their opportunity to bring them to the market, so they are also affected.
Well, now to address this case, we must ask ourselves which is more important, profit or life? To understand this dilemma, we need to talk at the numbers. Develop any new drug costs the industry between $1 and $2 billion. The ethical problem rises when companies weigh their options. If they invest in cancer drug, they recoup their money in less than 5 years and earn nearly 50 times their investment. The contrast is that is a new antibiotic is a terrible business from a financial viewpoint because doctors reserve it only for emergencies to prevent bacteria from becoming very resistant. And here we arrive at the central dilemma of our case that it's not that we lack science. Biotechnology exists, the scientists are there, and money is abundant. So, what is happening? The The dilemma is that they voluntarily choose not to use their technology because the business model does not favor them. So this led us to use a ethical key question that I want us to reflect on. Is it morally right for a private entity to be the sole owner of the key to preventing a future bacterial pandemic? Do these companies have a moral responsibility to keep laboratories open even if they are unprofitable, knowing that without antibiotics there will be no safe surgeries or transplants? So basically, we are letting the market to decide who lives and who dies, now and in the future.
Now, I will talk about the principles of bioethics. First, the autonomy. This means people have the right to choose and must understand the risk. Second, we have the beneficence. This means science should help people and have positive results. The third is the non maleficence. This means do not harm and avoid causing damage. And finally, we have justice. This means everyone should have equal access and no discrimination.
Okay, well, we will now examine the decisions that have been made and the price humanity is paying for them. The ethical choice made by the big pharmaceutical companies is clear because they have decided that their primary loyalty lies with their shareholders, not with patients in reality. So, by choosing to withdraw their investment from antibiotic biotechnology, they are actively pushing us toward what the WHO calls the post antibiotic era. What does this mean in real life? It means we are not verge of losing the greatest medical advances of the 20th century. So, without effective antibiotics, routine surgery, organ transplants, or even a round of chemotherapy becomes extremely dangerous because we don't have the way to fight against these secondary infections. And if we do not change the course of these ethical decisions by the year 2050, antibiotic resistance will kill more people than cancer. So furthermore, the economic impact will run into trillions of dollars. And in short, decision to save money today by not investing in research will cost us millions of lives and the collapse of the healthcare systems around the world tomorrow. So it is a short-term decision with catastrophic long-term consequences. Well, finally, to address these issues, Violet Biotechnology can help us arrive to several solutions that satisfy all parts. First, one solution is the UK's Netflix style model, where the government pays a fixed subscription fee of antibiotics regardless of how many are sold. Second solution is in the United States, the Pasteur Act offers guaranteed contracts to support companies as they develop new treatments. And the third solution is the European Union grants exclusively vouchers, extended profit periods for other medications as a reward. Mexico, by the way, is now implementing its strategy against antimicrobial resistance. Essentially, all these measures aim for the same thing to ensure that science advances without money being an obstacle.
But who are the stakeholders? The main beneficiaries are the large companies, as they prioritize the development of other treatments, as we discussed before. The cost of the development is of a new antibiotic is really high, and the time is another important factor to take account. So, exiting the area is a way to maintain the profit of the company. For example, take Novartis. It prefers to grow in areas such as gene and cell therapies as well in oncology treatments. Also, antibiotics, which are typically taken only in cases of bacterial infection and only for a few days, contrast with chronic patients which use treatments and products that patients can purchase on an ongoing basis. The large companies usually prefer the latter because they provide greater profits. Large companies believe that the economic value assigned to antibiotics is too low compared to the benefit to society, and they have called for new economic models that can be implemented. So this is a problem affecting everyone.